Your heart is slamming against your chest. Your hands are tingling. You cannot catch your breath. Your vision feels strange and your brain is screaming that something is terribly, catastrophically wrong, that you might be dying right now. But here is what no one tells you clearly enough in that moment. You are not dying. What you're experiencing is a panic attack. And in the next few minutes, I am going to show you exactly what is happening inside your body, why your brain does this, how to stop it when it happens, and what you can do to stop it from running your life. Panic attacks are more common than most people realize, according to the National Institute of Mental Health. Approximately 11% of adults in the United States experience a panic attack in any given year. Panic disorder, the condition where panic attacks become recurrent and begin to control your behavior, affects around 2 to 3% of American adults, which is roughly 6 million people. Globally, hundreds of millions of people have experienced at least one panic attack. And one of the cruelest parts of this condition is how alone it makes you feel in the moment it is happening. A panic attack is a sudden surge of intense physical fear that peaks within minutes and typically involves a cluster of physical and psychological symptoms that are genuinely terrifying. Your heart pounds or races. Your chest tightens in a way that feels like a heart attack. You feel short of breath, like you cannot get enough air no matter how hard you try. Your hands, arms, or face may go numb or tingly. You feel dizzy, lightheaded, or unsteady. You may feel nauseous or like your stomach has dropped. Some people feel a sense of unreality, like the world looks slightly off, like you are watching yourself from outside your body, or like none of this is quite real. And underneath all of it is an overwhelming, overpowering sense that something is terribly wrong, that you are dying, having a heart attack, going crazy, or losing control completely. These feelings are so convincing that a majority of first-time panic attack sufferers go to emergency rooms, absolutely certain something is medically wrong. And the tests all come back normal, which is disorienting, and for many people makes the fear worse, because if nothing is wrong, why did that just happen? Here is what is happening biologically. Your brain has a threat detection system centered in the amygdala, a small structure that monitors your environment for danger and triggers your fight or flight response when it perceives a threat. Normally this works correctly, but in a panic attack, the amygdala fires as if there is a catastrophic, life-threatening emergency happening right now, even when there is no actual threat present. This is sometimes called a false alarm. Your brain floods your body with adrenaline and cortisol. Your heart rate spikes to pump blood to your muscles. Your breathing speeds up to bring in more oxygen. Your blood vessels constrict in your extremities, which causes the tingling and numbness. Blood is redirected away from your digestive system, causing nausea. Your visual cortex sharpens to scan for threats, which can create that odd, hyper-real or dreamlike quality some people describe. Every single symptom of a panic attack is your body doing exactly what it was designed to do, preparing to survive a physical emergency. The problem is there is no emergency. The alarm went off by mistake. Research published in the journal Biological Psychiatry has shown that people with panic disorder have amygdalas that are hyperreactive to ambiguous or uncertain stimuli. A minor physical sensation, a slightly elevated heart rate from caffeine, a brief moment of dizziness, a deep breath that felt strange, can trigger the amygdala to misfire. Once it fires, the physical symptoms of anxiety begin. Then something called the fear of fear takes over, which researchers call anxiety sensitivity. You notice the symptoms, you catastrophize what they mean. Your anxiety spikes further, your physical symptoms intensify, and the cycle accelerates. This is the panic spiral, and understanding that this is the mechanism is the first step to interrupting it. A useful way to remember what is happening during a panic attack is the acronym DARE, which stands for diffuse, allow, run toward, and engage. Diffuse means recognizing in the moment that what you're feeling is a false alarm, not a genuine emergency. Your heart pounding is not a heart attack. It is adrenaline doing its job. Allow means stopping the fight against the sensations. Resistance amplifies panic. When you stop fighting the physical feelings and simply let them be there without adding catastrophic meaning to them, the adrenaline cycle has no fuel and begins to wind down on its own. Run toward means doing the counterintuitive thing, instead of fleeing the situation or lying down. Gently leaning into the experience and staying present. Engage means giving your nervous system something to do. A breathing technique, a grounding exercise, a sensory tool that interrupts the alarm signal and begins the calming response. Here is what actually works in the moment and why it works at the level of your nervous system. Controlled slow breathing is the single fastest way to interrupt a panic attack. When you are panicking, your breathing is fast and shallow, which reduces carbon dioxide levels in your blood, a state called hyperventilation. And this directly intensifies dizziness, tingling, and feelings of unreality. Slowing your breathing down and extending your exhale raises carbon dioxide back to normal levels and activates the vagus nerve, which signals your parasympathetic nervous system to begin calming the body. The technique that research consistently supports is called diaphragmatic box breathing or extended exhale breathing. Breathe in slowly through your nose for 4 counts. Hold for 2 counts. Breathe out slowly through your mouth for 6 to 8 counts. The exhale must be longer than the inhale. Repeat this for 2 to 3 minutes. Research published in Frontiers in Human Neuroscience confirmed that slow-paced breathing at 5 to 6 breaths per minute significantly reduced adrenaline, cortisol, heart rate, and subjective panic within minutes. This is not a relaxation trick. It is a direct physiological intervention on the exact mechanism driving your symptoms. Grounding with your 5 senses is the second tool and works by forcibly pulling your attention from the internal catastrophic narrative your brain is running and anchoring it in the physical present. The technique is simple. Name 5 things you can see right now. Name 4 things you can physically feel. The texture of your clothes, your feet on the floor, the temperature of the air. Name 3 things you can hear. 2 things you can smell. 1 thing you can taste. This is called the 5-4-3-2-1 grounding technique and clinical. Research on mindfulness-based interventions for panic disorder has demonstrated that redirecting attention to sensory present moment experience significantly interrupts the escalating catastrophic thought loop that drives panic intensity. Cold water is a lesser-known but neuroscientifically grounded tool. Splashing cold water on your face or holding ice cubes activates what is called the dive reflex, a built-in physiological response where your heart rate slows and blood flow is redistributed in response to cold temperature on the face. Research in the journal Psychophysiology has confirmed that facial cooling reliably reduces heart rate and sympathetic nervous system arousal within seconds. This is one of the fastest ways to directly slow a racing heart during a panic attack, using a mechanism that bypasses conscious thought entirely. Movement, specifically slow, deliberate walking, helps your body metabolize the adrenaline that has flooded your system. Adrenaline was released to fuel physical action. When you sit frozen and still, it has nowhere to go and the physical sensations persist. A slow walk does not need to be fast or intense. Even a gentle 5-minute walk gives your body a way to use the stress chemicals that are driving the physical symptoms, which research in the Journal of Anxiety Disorders has linked to faster physiological recovery from acute anxiety episodes. Sensory tools including smooth worry stones, textured fidget objects, and stress balls serve a similar grounding function. They give your nervous system a specific, non-threatening sensory signal to process, which occupies the same neural pathways that anxiety is using. Occupational therapy research consistently shows that proprioceptive and tactile input reduces sympathetic arousal in people experiencing acute anxiety and panic. Now let's talk about prevention, because stopping a panic attack in the moment is important. But stopping panic disorder from taking over your life is even more important. The most evidence-supported psychological treatment for panic disorder is cognitive behavioral therapy, with a specific component called interoceptive exposure. This is a technique developed in CBT protocols, where a therapist deliberately induces the physical sensations of panic in a controlled setting through spinning, breathing exercises, or physical exertion, and then guides you to tolerate and reinterpret those sensations without catastrophizing them. The goal is to break the association between physical sensations and the belief that they signal danger. Research published in JAMA Psychiatry has shown that interoceptive exposure produces significant and durable reductions in panic frequency and severity, often within 8 to 12 sessions. Acceptance and commitment therapy, known as ACT, is also used effectively for panic disorder by teaching psychological flexibility, the ability to experience alarming physical sensations without fusing with the catastrophic meaning your brain assigns to them. EMDR has shown growing evidence for panic disorder. When the attacks are connected to specific frightening memories or past traumatic experiences, mindfulness-based cognitive therapy has demonstrated in multiple clinical trials that it significantly reduces panic attack frequency by strengthening the prefrontal cortex's ability to regulate amygdala reactivity. Regarding medication for people with panic disorder, SSR is including sertraline and escitalopram are the first-line medication treatment, with a strong evidence base for reducing panic attack frequency and severity. They take 2 to 4 weeks to begin working and up to 12 weeks to reach full effect. Side effects can include nausea, disrupted sleep, headaches, a temporary increase in anxiety in the first week or two, and sexual side effects including reduced libido that may persist. For many people, the reduction in panic frequency makes these manageable. SNR is including venlafaxine are also commonly prescribed with similar evidence. Benzodiazepines can stop a panic attack rapidly, but carry significant risks of dependence and cognitive side effects, and do not treat the underlying disorder. They're generally reserved for short-term or situational use, and not recommended as primary treatment. All medication decisions should be made with a qualified physician or psychiatrist. Left untreated, panic disorder significantly affects quality of life. People begin avoiding places or situations where they have had panic attacks, a process called agoraphobia, which progressively narrows their world. Avoiding public transportation, shopping centers, crowds, driving, or being far from home are common. Major depressive disorder develops in a significant percentage of people with untreated panic disorder, as do substance use disorders when people use alcohol or other substances to suppress panic. Social isolation, relationship strain, and impaired work performance are well-documented consequences. What other people think about you during a panic attack is painful to navigate. Because the symptoms are often invisible from the outside or look like you are overreacting, people around you may misread panic attacks as attention-seeking, dramatic, flaky, or strange behavior. You may have left social situations suddenly, canceled plans repeatedly, or avoided events without being able to explain why, and been labeled unreliable or antisocial as a result. This misunderstanding compounds the shame that often surrounds panic disorder and keeps people from seeking help. The truth is that panic disorder is a legitimate neurological condition with clear biological mechanisms that respond to evidence-based treatment. You are not making it up. You are not being dramatic. Your brain fired a false alarm, and it did so because of patterns it developed, often in response to stress, trauma, or high-pressure environments, not because of weakness. Access to therapy and medication is a real and valid challenge for many people. Long wait lists, high therapy costs, cultural stigma around mental health, especially in communities where anxiety is seen as weakness or lack of faith, and lack of mental health providers in rural or underserved areas are barriers that affect millions of Americans. If formal therapy is not accessible right now. Self-guided CBT workbooks specifically for panic disorder, such as those developed by David Barlow and Michelle Krask at leading anxiety research centers, have clinical trial support for meaningful symptom reduction without a therapist. Free and low-cost online CBT programs, validated in randomized controlled trials, are also available. DARE, the acronym covered earlier in this video, is also the foundation of a self-guided program developed by anxiety coach Barry McNutt that has helped many people build practical skills between or before formal treatment. What does not work is avoiding every situation where panic might strike, which progressively makes the world feel smaller and more dangerous. Reassurance seeking, constantly checking your pulse, searching your symptoms online, or needing others to tell you you are okay provides momentary relief, but strengthens the belief that the sensations are genuinely dangerous. Drinking alcohol to manage panic dampens the nervous system temporarily, but increases baseline anxiety over time and significantly raises the risk of alcohol dependency in this population. The frustration of living with panic attacks, especially when others do not understand, when you have had to leave situations that mattered to you, when your life has gotten smaller because of something you cannot fully explain or control, is legitimate. You did not choose this. But panic disorder is one of the most successfully treated conditions in all of psychiatry. The combination of understanding the mechanism, learning to tolerate sensations without catastrophizing them, practicing the right tools consistently, and accessing support when it is available gives most people significant and lasting relief. Your nervous system learned to misfire. With the right tools and understanding, it can learn to stand down. If this helped you understand what panic attacks actually are and gave you tools you can use right now, please subscribe. Every week, we break down complex psychology and neuroscience into honest, practical, science-based content you can actually apply in your real life. Hit subscribe so you never miss it.